right, welcome. We're diving into a high-yield explainer designed to help you absolutely master Pseudomonas for your exams. We're going to break this superbug down into memorable, bite-sized pieces so you can recall all the key facts when it really matters.
So, here's our game plan for tackling Pseudomonas. First, we'll get to know the bug itself. Then, we'll look at its arsenal of weapons, see the clinical battlegrounds where it causes trouble, figure out how to be a lab detective and diagnose it, and finally, plan our counterattack with treatment.
Okay, first things first. Let's profile our opponent. Pseudomonas is a huge deal when it comes to hospital-acquired infections, so understanding its basic identity is the foundation for everything else we're going to talk about.
This definition right here, it's absolutely packed with exam clues. Non-fermenter tells you it uses sugars oxidatively, and critically, it loves moist environments. We're talking IV fluids, catheters, even detergents. You can see why it's such a persistent threat in hospitals.
Now for the really cool part. Let's look at its arsenal. We're going to break down all the virulence factors, the weapons, that make Pseudomonas so darn good at causing disease. So, the infection kicks off with a classic two-step invasion. First, it uses its Pili to grab on and colonize a surface. Then, its powerful polar flagellum acts like a little motor, letting it swim around and find its target. Pseudomonas has this really clever, two-pronged toxin strategy. The non-diffusible toxins, think of those as targeted shots from a sniper, injected right into our cells to help it hide from our immune system. At the same time, it releases diffusible toxins, which are more like a chemical weapon, causing widespread tissue damage. Look, if you're going to remember just one toxin, make it Exotoxin A. Its mechanism, shutting down protein synthesis, is identical to the diphtheria toxin. This is a classic, absolutely classic high-yield comparison you're almost guaranteed to see on an exam.
So how do you tie all these weapons together? We've got a fantastic mnemonic for you. CAP, pigment. This covers everything. Its antiphagocytic capsule, the alginate slime layer that's so critical for biofilms and cystic fibrosis patients, its Pili, tissue-damaging pigments, all the way down to its wide temperature tolerance. This is your one-stop shop for virulence factors.
Okay, so we've seen its weapons. Now let's check out the damage this pathogen actually causes. We're going to explore the main clinical battlegrounds where you'll run into Pseudomonas infections.
And to remember the common infections, you've got another great mnemonic, HCREPS. This covers the big ones: healthcare-associated infections like ventilator-associated pneumonia, chronic respiratory infections and cystic fibroses, those nasty ear and eye infections, endocarditis in IV drug users, horrible pus-forming skin infections in burn patients, and of course life-threatening sepsis.
You know what they say, identifying the enemy is half the battle. So let's put on our lab detective hats and check out the key lab findings that totally give away Pseudomonas' identity. Visually, Pseudomonas gives you some classic clues on nutrient agar. Just look at this. You get these large, irregular colonies with an unmistakable metallic sheen. And see that blue-green pigment, Pyocyanin, spreading into the agar? That look is practically diagnostic. But it's not just what you see. There's another sense that's a huge giveaway in the lab. This bacterium has a very distinct odor that every microbiologist and clinician should know. Any ideas what that might be?
Yep, it's a sweet, fruity odor. It's often described as being grape-like or even like corn tortillas. If you smell that in the lab, Pseudomonas should be right at the top of your list. It's a classic clinical pearl.
And its appearance on different agars? This is super high yield for your practical exams. On blood agar, you're looking for beta hemolysis. On McConkey agar, since it doesn't ferment lactose, it gives you those characteristic pale colonies. You've got to know its reactions on these key media.
Now for the biochemical confirmation. Remember the I-cut profile. Indole negative, citrate positive, urease negative, and that classic K/K reaction on TSI agar. And of course, do not, I repeat, do not forget the big two. It is both oxidase positive and catalase positive.
All right, we're in the home stretch. Let's talk about our strategy for fighting back. This section is all about treatment options and the massive challenge of antimicrobial resistance.
This table shows our main lines of attack. We've got options across several classes. But, and this is a huge but, you cannot treat Pseudomonas just by picking something from this list. Its resistance rates are so high that antimicrobial susceptibility testing is absolutely mandatory to guide your therapy.
This is a massive exam alert. Just as important as knowing what to use is knowing what not to use.
Pseudomonas is naturally resistant to a lot of common antibiotics. Using one of these drugs isn't just ineffective, it's a clinical mistake. So make a mental note of the examples on this slide.
And on top of its built-in resistance, it's a master at acquiring new defenses. It can produce enzymes to destroy our antibiotics, and its ability to form a biofilm acts like a physical shield, stopping the drugs from even getting to the bacteria. This all makes treatment incredibly difficult.
So, against a bug this formidable and this drug-resistant, prevention is our absolute best weapon. And the single most effective preventive measure is actually deceptively simple: proper hand hygiene. It is the #1 way to break the chain of transmission in any healthcare setting, period.
This leaves us with one final thought to really lock in the main lesson. When you reflect on this question, it just reinforces that fundamental principle of infection control. In the complex battle against a superbug like Pseudomonas, sometimes the most powerful weapon we have is also the simplest one.